Why is Lyrica a controlled substance when gabapentin is not? That is the question we'll be looking into and deeper diving into today. Lyrica versus gabapentin and why Lyrica is a controlled substance. Before I go any further, please like and subscribe to the channel, hit that bell icon, and also leave a comment on if you've had either of these medications prescribed before, Lyrica or gabapentin. This is your daily dose of mental health, and let's jump right on into it. All right, now let's first jump into some of the common similarities between both gabapentin and Lyrica, and the basic mechanism of action on how both these drugs work. Which one thing to note is that we don't exactly know everything about both these medications, and we don't know exactly how they work. We just have a decent understanding based on evidence from patients taking it, how it works. So let's begin. Gabapentin and Lyrica are both used for anticonvulsant purposes, which means for seizures, which means they're used to treat seizures. They're also used in the later stages of treating herpes, which is the pain from the shingles. And it's also, they're both also used to treat different types of neuropathic pain that typically other medications would not assist with. So it's like generalized nerve pain as well as what both of them are used for as well. But I'd like to emphasize that once again, we don't know the exact mechanism of action and how they work. But we do know one thing for sure about both Lyrica and gabapentin. And before I go any further real quick, let me just back up. Lyrica is the brand name for the drug pregabalin, and gabapentin is the name of the medication that is named Neurontin. So you'll see so you'll either see Lyrica listed as pregabalin, and also gabapentin as Neurontin. They're interchangeable, just depending on the brand names. But one mechanism of action that we do know for sure is that Lyrica and gabapentin are both structurally similar to the brain chemical GABA, which is the same brain receptor that benzo's attached to, which once again is a major inhibitory neurotransmitter in the central nervous system. So that is one pathway we do know that does work. Also, let me go over some similarities between them. Because Lyrica and gabapentin belong to the same class of medicines, the gabapentinoids, they do have a lot of similarities. One would be a shared mechanism of action, which already discussed prior, which means the way the medicines work. Although experts are not exactly sure what the mechanism of action is, they suggest it is through the binding of certain pathways in the nervous system. Even though both are structurally similar to attaching to GABA, as stated, they do not bind to GABA or the benzo receptors. So what I said prior to that, in regards to we think they reattach to the GABA receptors, which, as stated above, they do, and they do cause CNS depression, central nervous system depression. We just don't know exactly how they do. So think of your receptor site as like having different keys. So for benzos, let's just say they attach to the top. It attaches to the top of the receptor. With Lyrica and gabapentin, we don't know the site that the GABA is attaching to. We still think it uses GABA, and actually we do know that it uses GABA. That's what causes that depressed state. It's a downer, but we just don't know exactly where it attaches. So I know that can be kind of confusing, but it's one thing that I think is pretty important to know. Also, both Lyrica and gabapentin have been associated with misuse, and in some countries they are classified as controlled substances, which that is exactly what, when looking at this, what we'll be attacking a little later on in this. So essentially, they are associated with misuse, and in some countries they are classified as being controlled substances. Lyrica is classified as a Schedule 5 controlled substance in the United States currently. Gabapentin is not classified at all. Classified as a controlled substance on a federal level. However, some states in the United States have classified gabapentin as a controlled substance at a state level. Now, with these, they change constantly, but some of the states that show gabapentin as that has the controlled substance title are, I think, Kentucky, Virginia, West Virginia, Michigan, and Tennessee. Don't quote me on that because it's changed. But through they essentially utilize the prescription drug monitoring program, which is used for all controlled substances. And also, and with this as well, you have to realize that unfortunately in other states, they could easily flip the switch and easily classify and schedule gabapentin just like Lyrica, which in my opinion is really stupid because once again in the clinical setting I've seen a lot of the benefits that it has for people. The main problem that people typically run into with gabapentin in Lyrica are that they either try to quit them cold turkey, which will cause horrible withdrawal side effects, and as well a lot of patients that are prescribed these, which have different types of neuropathic pain or epilepsy, different types of seizures, typically these patients as well are taking a lot of other medications that could either be depressants or uppers as well, or stimulants, which can lead to a wide variety of, is this causing, when the FDA indeed is looking at this, they're saying, is it the gabapentin and the Lyrica that is causing these highs or these overdoses? Or is it what else? Or is it something else they're taking? So that's just a little bit more insight into that. Some similarities as well between the two medications are some side effects, such as dizziness, drowsiness, loss of balance or coordination, problems with memory, double vision, concentration issues, tremors, vision problems have been reported with both these medications. And lastly, a similarity is both Lyrica and gabapentin have both been associated with withdrawal syndromes on discontinuation, which that's what I was saying just like a minute ago, is a lot of times if you try to quit these cold turkey, these two medications, you can run into some pretty bad withdrawal side effects. And if you have a seizure disorder, you can have rebound seizures, or even if you don't have a seizure disorder and you're taking it for nerve pain or, as I said, like neuropathic pain, it can cause things like seizures, cognitive issues, things like that. And lastly, real quick, both these medications are also now starting to be prescribed for anxiety, which I've seen, and I actually have seen good results in particular with Lyrica. I actually had a patient. This was like he's been in the inpatient setting for the past, like, he was there last month, and he's been there off and on for the past year, having horrible anxiety and things like benzos weren't working well, and he was having cognitive issues with it. However, they prescribed him Lyrica, and he tried gabapentin, which didn't work well for him, but it can work. Lyrica actually really reduced the amount of anxiety he had. And it wasn't like, it lasts for an hour. He would, he'd take, it was like 150 milligrams twice a day, and he was a completely different person. And once again, not high or anything, but it was just, he actually felt comfortable going to groups, communicating with the staff and his peers. So these are just some of the similarities that I wanted to address real quick. Next, I'll jump into some of the differences and the most important aspect of why on earth, why is Lyrica a controlled substance and why is gabapentin not a controlled substance? All right, so let's go ahead and jump into some of the differences. Before I go any further as well, please like and subscribe to the channel. But real quick, just a summary of Lyrica and Gabapentin. They are both used as anti-epileptic medications, and they're used to treat neuropathic pain or nerve pain. But here are some of the differences between them that I've seen, or just I remember in nursing school is Lyrica is a brand name for pregabalin, obviously. Gabapentin is the generic name. Gabapentin is the generic name of gabapentin. Gabapentin is not the same as pregabalin, obviously, even though they belong to the same class of medicine called gabapentinoids, and they do work similar in a very similar fashion. They do not attach the same way. Also, Lyrica and Lyrica CR are the only brands of pregabalin. Brand names for gabapentin include Gralise, Horizont, and Neurontin. Lyrica and gabapentin are not interchangeable. You cannot switch between them without your doctor's advice. This is the big thing. Even some brands of gabapentin are not interchangeable. So that's one big thing to take away is you can't just interchange both these medications because you will have different side effects. And even as I said, with gabapentin, there are some brands of gabapentin that you cannot just interchange between without talking to your doctor about. Also, Lyrica may also be used to treat neuropathic nerve pain associated with diabetic neuropathy, also spinal cord injuries and fibromyalgia. Gabapentin is not typically used for some of these other purposes, in particular the spinal cord injury or fibro. Also, gabapentin may be used to treat nerve pain caused by shingles, which is herpes zoster. And gabapentin, there's one that has the brand name of Horizont, is also approved for restless leg syndrome. And also, gabapentin may be used for off-label conditions as well, sometimes anxiety, but typically that would be Lyrica for that purpose. But it's becoming more accepting though. Also, Lyrica is more likely than gabapentin to cause side effects such as dry mouth, constipation, swelling, breast enlargement, or weight gain. So that's one thing that you do take into consideration sometimes between two, because with a lot of psych medications, a lot of people are concerned with the weight gain aspect of it. And Lyrica typically you're more likely to, in particular, gain weight. Now, and that's for Lyrica. Now, gabapentin, is more likely than Lyrica to cause side effects such as difficulty speaking, fever as well, and increased risk of viral infections, unusual eye movements, or jerky movements. The reason why I say this is because I've actually seen somebody who was on gabapentin, and they developed, and they were on another antipsychotic, and they actually developed some very unusual eye movements to where they looked like they were like vibrating. The fever one as well, I have seen. So let's say somebody is before you give them medication, you'd actually want to check if they actively have an infection, because it could spike their fever. And also, a big difference between the two is Lyrica is absorbed faster and starts working more quickly than gabapentin, which will lead into my next point, which is really big, is this why Lyrica is a controlled substance? So Lyrica reaches peak concentrations within an hour of being taken, whereas it takes 3 to 4 hours for gabapentin to reach peak concentration levels. There also is some evidence that Lyrica may have higher addiction potential than gabapentin due to its faster absorption and onset of action, which is what I want to focus on. And also, just another thing, although both drugs have similar interactions, gabapentin may also interact with NSAIDs such as ibuprofen, naproxen. Those two in particular, those are really the only ones I wanted to cover real quick. But let's jump right back into it, and how I was talking about how Lyrica, how it hits its peak effect a lot faster, and it is essentially absorbed a lot faster than gabapentin, and is this the reason why it's a controlled substance? So essentially, real quick, the prescription medication, pregabalin or Lyrica, in its generic form, isn't a narcotic. It's a GABA analog that's roughly 3 to 4 times more potent than its predecessor gabapentin. Now here's something. According to research published by the United States National Library, National Library of Medicine, it works by powerfully binding to components of the nervous system to soothe damaged overactive nerves. Sorry for butchering a word like a couple sentences ago. I'm bad about that sometimes. These are just notes sometimes that I like to jot down. But the big key is the reason why it is a controlled substance. They work very similarly, different side effects though, different ways they attach to the GABA receptor site. But the main purpose is they do it because of how it's absorbed a lot faster, which can cause, more dizziness, more of a quote-unquote high, which I'm not shaming at all. I don't think Lyrica should be a controlled substance, because at the end of the day, if you quit either of them, cold turkey or even taper, you can have withdrawal effects from them. Also, the one thing, side effects like dizziness and sleeplessness could increase if you take Lyrica with alcohol or narcotic medications, which once again, that's what I was talking about earlier with both of these meds. A lot of times they're taken with other medications. When somebody has like nerve pain, they typically take multiple meds, or even seizure disorders are taking different meds, so there are going to be interactions. In my opinion, although there needs to be more research on Lyrica withdrawal, it's needed because we don't fully understand the risk of what happens. Also, patients who stop taking it, as I said, without tapering, which once again, a taper, you would get off the meds slowly, so you'd bring the dose down over time, typically over a month or so, or longer. If you do a tapering, if you taper the dose over time, you could experience, if you do not go through a taper, you could experience very harsh withdrawal symptoms compared to if you do a taper. So if you do a taper, which I've covered in other videos, it's typically less intense. So the main purpose is, I wanted to throw this out here because I've seen multiple times in the clinical setting, patients are prescribed gabapentin or Lyrica because obviously certain seizure disorders, epilepsy, and in particular for people who have chronic conditions where there's not a specific medication that helps in specific types of pain, like neuropathy, different types of nerve pain, even post-herpes with the shingles. These meds do help, but the big purpose though is, just because they work very similarly, the question I raise is, just because Lyrica has a faster onset of absorption and rate in which it works and is a little bit more powerful, should it really be a controlled substance for that reason? Because all we're really saying is that gabapentin at the same time works very similarly, and it has a longer onset to kick in, and that's why that's not a controlled substance. Personally, I think it has to do with, I'm sure, there's probably more research of people who've taken Lyrica and they've been taking other medications with it, or that case of somebody driving drunk, to where that's why it's a controlled substance. But in reality, in my opinion, I don't think either should ever be. So I don't think gabapentin should ever be a controlled substance, or I think Lyrica should be switched, because when it originally was put on the market, it was not a controlled substance, kind of like tramadol. And I've seen how much Lyrica works, and in particular, between gabapentin and Lyrica, and why I'm such a bigger advocate for it and why it shouldn't be controlled, is the main reason that it helps tremendously with people who've tried different medications for anxiety, from Buspar to Vistaril. Those are the light anxiety meds that don't help a lot, to going to benzos, which are very addictive and powerful and can cause tiredness and don't help specific people. Don't get me wrong, they help some, but they don't help everyone. And then you have meds like Lyrica that people can't get prescriptions for because they're a controlled substance a lot of the time. When I've seen it work miracles for people. And that's why I did this video. I'm just, once again, trying to advocate for everyone out there. I'm not promoting different drugs, but I just like people to be in the loop in regards to just understanding different drugs and different, educational topics that should be covered, in particular in the psych setting and things I see in pain as well, that you wouldn't get from, most, from your prescriber a lot of times. You'd have to go research all this your own, which can be a lot. And that's really the point, is just to summarize and talk about some controversial topics in regards to why are some meds controlled and why are some not. But I thought I'd cover this real quick. Once again, leave a comment if you like the video, like and subscribe to the channel. I greatly appreciate it. Hit that bell icon in the right hand corner, either side. But leave a comment. Tell me if there's anything you want me to cover, but I'm just going to continue to make a video every week. This was kind of a random one out of the blue, but be on the lookout for another one within the next week. This is your daily dose of mental health, and I love you all, and have a safe weekend, and just a safe life in general, and be safe out there, because you just sometimes, even outside of this, there's going to be drugs on the street. I know, that you don't know could be covered even with fentanyl and things like that if you're trying to pick up stuff. This is why I'm really big into, a lot of times, just legalizing a lot of, like, for example, with Lyrica, not making it a controlled substance and making it more accessible to people. This is your daily dose of mental health. I love you all.